Smith. I'm going to be the physical therapist assistant student working with you today. I was wondering if you could verify your name and birthday for me.
Sure, it's John Doe, and my birthday is 9/8/1888.
Alright, perfect. How's your pain level doing today?
It's about a 3.
About a 3. Is there anything that you notice that aggravates it?
Yeah, yesterday I was moving some pots around for my wife and kind of bending over, and I think I kind of pulled some muscles a little bit, and it's just a little tight.
Kind of tweaked it a little bit. Alright, well we're going to be working on some proper lifting and squatting techniques today. Is that alright if we work on that today?
Yeah.
Alright, awesome. So the first thing I'm going to show you is we can stay sitting like this. We're going to work on a neutral pelvis. So our pelvis can kind of tilt two different ways. It can tilt anteriorly and it can tilt posteriorly. So what I want you to do is feel for those hip bones right in the front there. They should be protruding out a little bit. Feel those ones?
Oh, yeah.
Okay, perfect. And you're going to reach around the back by your spine, just a little lower. You should feel those ones in the back too. Okay, so first thing I'm going to do is I'm going to have you move your chest forward, kind of kick that butt in the back there, and your back should arch a little bit. You feel it tilting out? So you can come back to neutral and feel it again too. So we're going to kind of arch that back, sliding that chest forward and the butt back. Okay, so that's an anterior tilt. The second one we're going to do is we're going to hunch over, slouch in our chair a little bit, and that's going to be a posterior tilt. You kind of feel that sliding back. So what we want to do is we want to try and keep that as much in neutral as possible. With the squat that we're going to do today, at the very end there's going to be a slight anterior tilt, but that's normal. But for your purposes, I just want to try and focus on keeping that good posture.
Okay.
And another thing that we're going to work on is you can stand up now. This is going to work on keeping the back straight. So I'll show you real quick. We're going to grasp the cane right behind the back here, and we're going to keep this hand pressed right up against our spine. So what we're trying to avoid when we squat is bending at the trunk, because then that hand is lifting up off the back. So when we squat down, we want to keep that hand up against the spine and flex up the hips instead. And that will kind of keep that back straight. So I'll hand this to you.
It's pretty.
So again, yep, try and keep that hand pressed up against there. And you can try kind of squatting down a little bit and feel that hand being pressed up against that spine there. So we want to avoid bending at the trunk when we do this exercise today.
Okay.
I can take this from you. So I'm going to kind of explain what we're going to go do today. So it's called, like I said, a deep squat. And then what this squat is used to pick up boxes or books, something off the ground that you need to stoop down to get. It's going to be a little lower than a normal squat you're used to, which is where that anterior tilt comes in at the end. And with this, what we're going to do is we're going to approach the object, straddling it just slightly. And you can either keep like shoulder width apart or slightly wider base of support.
Okay.
And then when we stoop down, we want to keep everything kind of facing forward. So shoulders squared, head facing straight forward, and we want the weight on the back of our heels. So I don't want you rolling up at the end on your toes here. And we're going to tighten those abs as we go down, and we're going to flex up the hips. So everything just kind of going straight down as we stoop down and get it.
Alright.
And so now I'll show you it, and then we'll kind of go over the home exercise program that I printed out for you. So I'm going to approach the box, and I'm going to keep my feet parallel with it. I'm going to keep my weight back on my heels, everything facing forward. I'm going to be flexing down at the hips here. I'm going to stoop down to get it. You're going to keep this close to your center of gravity, and you're going to do the same thing coming back down. And sit back down. So here's kind of a little exercise in case you forget any of the steps at home or anything like that. One thing I want to emphasize is the importance of these proper body mechanics is to avoid injury or straining the back or the spine or anything like that that you might have noticed. So just kind of to protect those muscles in the back and keep good posture is kind of an important thing with this. So we'll have you try it next. Does that all make sense?
Yeah, so I'm going to approach it, feet apart from it a little bit,
Okay.
squat down, keep my posture good, and use my legs to lift up and flex my abs.
Yep, and make sure you're staying back on your heels. So we'll let you try it out here. Okay, and I'll have you keep that same posture, putting the box back down. Perfect. How'd that feel?
Felt a lot better.
Felt a
My
lot
back
better?
didn't hurt when I did that.
Yeah, so we'll have you try implementing that at home, and hopefully that helps out with like the pain and keeping those back strong. Do you have any other further questions about this?
I think I'm good. I get to take that home, right?
Yes, this is yours. All right,
It looks fit.
and we'll see you next time.
Alright, thank you.